Hello, my name is Jeong, currently working at Samsung Medical Center as a fellow on pediatric cardiology. And I am gonna present a brief case about a 5-year-old female today. As a brief history, the patient had TOF total correction in 2016 and had regular follow-up since then. During follow-up, severe pulmonary regurgitation and both pulmonary artery origin stenosis was found. And we underwent balloon angioplasty in April 2021. However, after ballooning was done, we could not see the waist of the balloon. Even the catheterization data did not show any improvement of pressure gradient between main pulmonary artery and branch pulmonary artery after the procedure. So, determining the ballooning has no effect on her current status, stent insertion was further planned. The patient was rehospitalized 3 months later. At the moment of hospitalization, her vital signs were within normal range. No symptoms were reported, and grade 3 systolic murmur at both sides of her sternal border was observed on physical examination. Her pre-catheterization labs were normal. EKG was also done, which showed sinus rhythm with right ventricular hypertrophy. Both pulmonary artery originate stenosis were observed at her pre-catheterization echocardiogram. This is her heart CT scan. There were stenosis at RPA and LPA origins. Each measured 5.5 mm and 4.5 mm respectively. Branch pulmonary artery angiography was done, and you can see the stenosis of both pulmonary artery origin. We have checked her IVC size through IVC angiography and decided that it was too small for two 12 French long sheets to be placed at once. We decided to insert stent on the right pulmonary artery first. We tried to insert 12 French long delivery sheets through her right femoral vein, but entry did not go smooth because the sheath was too long and stiff, and emplanage wire became unstable. So, insertion was done with 12 French short sheaths without long one. Hand mounting was done with 21 mm Andra stent on 18 mm Atlas gold balloon. And then the balloon was located at proximal right pulmonary artery through right femoral vein without long sheaths. After, stent ballooning of right pulmonary artery was performed. However, the waist still remained. On the left side, hand mounting with 21 mm Andra stent on 18 mm Atlas gold balloon was also done. On the way up to left common iliac vein, the stent kept slipping. So we decided to proceed left common iliac vein angiography on the location and started to stenting. Thinking that left femoral vein was not proper to continue the procedure, we decided to approach through right femoral vein. Same was done, but the stent slipped again on the right ventricular outflow tract. So we inflate the proximal part of the balloon a little bit and locate the stent at left pulmonary artery origin. When we inflate the rest part of the balloon, the stent slipped away from the balloon. So we inserted another balloon catheter in front of the stent and then inflate it so that the stent can be stuck between two balloons. In that case, we were supposed to move and relocate it to the proper location. However, it did not work well. Try to relocate the stent by grabbing it with a 20 mm snare, but also failed. So we just took the balloon out. Another try with 14 mm Armada balloon was also failed. The stent moved further away to the distal portion. So a size smaller, which was 12 mm in a diameter, Armada balloon was inserted into the stent. To prevent the stent from slipping away, we grabbed the stent with a snare, and then the ballooning was done successfully. Even though considerable portion of the LPA stent was protruded into the main pulmonary artery, the narrowed portion was covered anyways. On the catheterization data, the pressure gradient between main pulmonary artery and both pulmonary arteries were decreased. This is echocardiogram after the procedure. You can see the flow of the right pulmonary artery is patent. Also, the same is patent on the left side. On her post-procedure heart CT scan, both pulmonary artery origins were widened than before. The patient had closer observation period on ICU and discharged when the stability of her stent position was confirmed. This is all I have prepared today. Thank you so much for listening.